I take it just by virtue of the fact that you're sitting here this morning, that hospitalization or being a hospitalist is of some interest to you. There's a rather new specialty in medicine called a hospitalist. And this is the result of managed care and HMOs contracting with specific hospitals so that all the patients in that HMO go to very specific hospitals. Well, the question is, who's going to take care of them? The primary care physicians can't do it because they're sitting in their offices with 100 people sitting in a waiting room, which, by the way, the New England Journal of Medicine in the 1970s published an article that said you have 17 seconds to communicate what's wrong with you to your physician. On second 18, they're thinking about the next patient in the waiting room. So just as an aside, little pearls every once in a while. One pearl I have for you is that when you're taking care of patients and you know they have to see a physician, tell them to write down exactly what it is they want to communicate to that physician, write down all the medications that they're taking, and make sure they have a copy of that and give it to the doctor when they go see him or her. That way, when it comes to second 18, at least the physician has a piece of paper in front of them with the patient information on it. I don't mean to get lost in that direction, but the specialization of hospitalists is a direct result of HMOs requiring or needing physicians to take care of patients in the hospital because all their other contracted physicians are in the office. Okay? Now, as years have gone by, there are some non-HMO physicians that find being a hospitalist attractive, so they're kind of moving into there. It's not a board certified specialty yet. I don't know if it will be, but they just move in that direction, identify themselves professionally as a hospitalist, and sure enough, the referrals are there because people are in the hospital. How many of you have actually been in a hospital as a non-patient, but either consulting or employed or something like that? So, okay, so we're preaching to the choir here. You know the value then of what you can provide for the patients and their providers in terms of your clinical skills? Yes? Okay, so you've been able to use your clinical skills and expand them in ways that you weren't taught to do in school.